Good morning. So today we're going to learn about teaching and learning in nursing. We're always supposed to be teaching our patients. That's one of our responsibilities in nursing, according to the American Nurses Association. So nurses have been teaching patients since Florence Nightingale taught nurses and patients about the value of good nutrition, fresh air, exercise, and personal hygiene. The main reason nurses teach in the hospital setting these days is to empower patients so that they can participate in their healthcare decisions. So teaching clients is a part of independent nursing practice. Remember how I said that as a nurse, we don't need a doctor to do our job because we have our own set of knowledge. So this is that independent knowledge that I am talking about. So we don't need a doctor to tell us to teach a patient. We just need to do it. So the basic purpose of teaching and learning is to provide information that's going to empower clients and families to, number one, perform self-care, and number two, make those informed decisions about their healthcare options. Like other interventions, you can use teaching to promote wellness, prevent illness or limit it, restore health, adapt to changes in body function, and help cope with stress, illness, and loss. The American Nurses Association Standard 5B, says that the registered nurse employs strategies to promote health and a safe environment. So the following are the specific measurement criteria for that standard. First of all, we provide health teaching that addresses topics like healthy lifestyles, risk-reducing behaviors, developmental needs, activities of daily living, and preventative self-care. We use health promotion and health teaching methods appropriate to the situation and appropriate to the patient's values, beliefs, health practices, the patient's developmental level, their learning needs, and their readiness and ability to learn. What is their language preference, their spirituality, their culture, and even their socioeconomic status? We also seek the opportunities for feedback and evaluation of effectiveness of the strategies that we used. So basically what that is saying is that we want to know if our patients actually learned something from what we taught them. Teaching skills and nursing practice. Why do nurses need teaching skills? Well, again, clients and families need information to make decisions. Primary care providers expect patients to take an active role in making decisions about their health. Patients and families need information so that they can make informed decisions. You can help patients get answers to their questions, to find resources, to recognize problems, and develop self-care behaviors. Another reason we need teaching skills is because nowadays there are much shorter hospital stays, and we have the responsibility to teach family members how to provide care and to teach patients to care for themselves as much as they are able. Teaching helps with compliance, and it shortens hospital stays and medical complications. So what do I mean that it helps with compliance? That means that if we teach someone how to take care of themselves and how to do something, they are more likely to do it. So teaching increases a patient's compliance with medical and nursing regimens, which can shorten their hospital stay and decrease their frequency of medical treatment and admissions. Again, teaching empowers patients and families to perform their own self-care and to make those informed decisions about their healthcare options. Just like we have the 5 rights of medication administration, we have 5 rights of teaching. First of all, we want to do it at the right time. The right time means, is the patient ready to learn at that particular time? Are they too tired? Are they free of pain and anxiety? Are they even motivated to learn at the time? Have you already developed a rapport with the patient? If you haven't, you might need to work on that first, because after you develop a rapport would be a better time to start teaching a patient. And have you set aside sufficient time for teaching this patient how to do something? The next right is the right context. Is the environment that you're teaching in, is it free of distractions? Is it private? Is it quiet? Is it soothing, or is it stimulating or too overstimulating? Maybe you want it to be a stimulating environment depending on what kind of presentation that you are giving or what you're teaching your patient. The right goal. I'm sure you've heard of SMART goals already. But is the learner actively involved in planning the learning objectives? Like, what do they want to learn? Maybe you want to teach them all about something, but maybe they have a different idea of what they want to learn. Are you and your patient both committed to reaching mutually set goals? Are family and friends included in the planning so that they can help follow through? Are learning objectives realistic and valued by the patient? Do they even reflect how the patient lives and what is their lifestyle? The right content. Is the content appropriate for what the client needs? Is it new information or reinforcement of information that has already been given the patient? Is it presented at the learner's level? We don't just teach adults, we teach children as well. So we need to make some kind of adjustment to how we provide instruction to children, depending on their developmental stage. Does the content relate to the learner's life experiences, or is it otherwise relevant to the learner? Most adults have put up a shield if they don't think that whatever is being taught pertains to them. So you have to make people understand how important it is that they learn it. The right method. Do the teaching strategies fit the learning style of the learner? If someone is a hands-on or kinesthetic learner, it does no good for those people to simply sit and lecture, and that's it. That is why with your NUR 230 class, it is not strictly lecture content, but also driven by a skills lab where you get to put your hands on things and manipulate things so you learn and you understand better. So when setting goals as to with your patient as to what is being taught and what they want to learn, when we state the goal has to be specific, it has to be measurable, it has to be achievable, it has to be relevant to what the patient is supposed to learn, and it needs to be time bound. So we have to state when it is going to be accomplished. So SMART goals. Teaching is a process that involves a teacher and a learner. Something that you need to remember about teaching is that it requires good communication skills. The nurse needs to adequately be able to convey information. The nurse needs to be able to assess verbal and nonverbal feedback. For instance, if a patient is saying, yes, I understand, but they have this look on their face like, I don't have a clue what you just said to me, then perhaps you need to revisit what you just taught that person. Nurses need to accommodate various learning styles, and we'll talk about those learning styles in a bit. In patient education, nurses can use teaching, counseling, and behavioral modification together to achieve effective client learning. So what do I mean by behavioral modification? One thing that I can think of, I wanted you to just think about that just very briefly. What is behavioral modification? How do we modify somebody's behavior? We can't modify somebody's behavior, but we can certainly provide education that in which we hope that they will internalize and they will then change their behavior. For one example I can give you is teaching a patient about smoking cessation. They're the ones that have to internalize the information. They're the ones that have to understand that it can change their life if they stop smoking. So that is a behavioral modification if we can get them to actually stop smoking. Teaching includes providing activities that allow clients to learn. So we want to identify learner outcomes, and they have to be established before we ever start teaching. So we are, again, asking the patient, what is it that you want to get out of this teaching session? What do you want to learn? And, if they want to, let's say if they want to learn how to, if they're diabetic and they want to learn how to give themselves an insulin shot, then that is an identified learner outcome. So that's going to be your guide for choosing the activity. And so what would the activity be, do you suspect? If they want to learn how to give themselves an injection, then you're going to take a syringe and vial of insulin and have them, you can demonstrate it to them and have them demonstrate it back. What I used to do in the clinic when people asked me to teach their patients about using an insulin pen, the patient would have to leave the office, or they needed an injection, they needed the insulin before they ever left the office. So I would go in introduce myself, identify the patient, wash my hands, do all those things. But then, I would explain to the patient, and they usually already knew what I was in there for, was to teach them how to use their insulin pen. Well, I would go over the entire pen with them, like this is what this is, these are the different parts, this is what you do, etc. And then I would give them the pen and I would say, can you show me this part of the pen? Can you show me that part of the pen? And before they left, I'd give them an alcohol swab. I'd explain the entire procedure to them. And usually the insulin pens come in a package that has it has instructions in it and pictures. So I would show the patient the pictures as I went through it. And then I laid the pictures out for the patient. And I said, now here, can you do this? I want to make sure that you know how to do this before you leave. And they would give themselves their own insulin injection before they left the clinic. So again, you just have to identify what your learner outcomes are, and that guides you to choose whatever learning activities you need to provide for your patient. I mean, that is not the best situation that I am describing, because usually what happened is one of the nurse practitioners would come in. They had a patient in their room, and they would come and say, Ellen, can you come and teach this person how to give themselves an insulin injection, or can you come and teach this person how to use their insulin pen? And, just like I said a while ago, you need to establish a rapport with the patient before you ever start teaching. So within a, 15-minute to 20-minute time frame there, it's kind of difficult to do, but it is possible. So just, it just kind of depends on where you are working, how your teaching is provided to patients. So who and what do nurses teach? So as a nurse, you can instruct nursing assistive personnel, nurses assistants, when you observe an error in their technique, possibly. You can help a new nurse learn how to use new equipment on the unit. Nurses in practice are involved in clinical instruction of nursing students and new graduates and other members of the healthcare team. Most of the teaching can be informal, but you might even put together a presentation of a certain topic and present at a unit meeting or at a conference. For instance, if there's a change in the agency's documentation system, you might teach a class to the nurses on how on your shift to learn the new system. Let's see, let me think about this. So again, you can help orient new people. If you see an error, somebody committing an error or something, if you have identified that that is a frequent error, again, you can formulate some kind of an educational activity for your unit. At the clinic I worked at, I would do, since I was a nurse manager there, I would also do presentations at our monthly meetings about, any. I think one I did was on, started during flu season, so I did a presentation on how to appropriately gather a nasopharyngeal swab, because some people do not really understand how to do that, or where the nasopharyngeal swab, where that little swab needs to end up when they put it in somebody's nose. Another one I did was thing on hand washing for JCMG. So again, just things that you identify that need to be covered. You can do it with patients or with employees. So what do you teach? When you teach patients or other nurses, you can teach about disease information. What are the signs and symptoms? What are the treatments? How do we evaluate the disease? How do we evaluate somebody to know that it's getting better? Patients particularly need and like information about new medications or even the ones that they are on. Like, what are the side effects of this? Uh, when do I take this? How often? Are there restrictions on me taking this at a certain time? That type of thing. Can I drink alcohol and take this medication? So lots of different things that you can teach people. Another huge area that we need to teach patients about is procedures that are going to happen to them. Most people come in and have no idea about the healthcare setting, so that is our responsibility to make sure to get rid of their anxiety, to tell them all about what is going to happen to them in their procedures. So you explain the procedure, you explain any dietary restrictions or activity restrictions before and after the procedure, and as much as you know about that procedure, just make sure that your information is factual that you are giving them. You can tell them as much as you know about a procedure. For instance, if you go to the operating room and observe a cholecystectomy, a gallbladder removal, or something like that, and you have a patient at some point in time in the future who is going to have gallbladder surgery, you can tell them every single thing that you remember about that gallbladder surgery when you saw it as an observer. Just, you don't want to scare them, you just want to give them information. So make sure that the information you give them isn't going to scare them. Like, oh, I saw this guy, he had a lot of bleeding. No, you don't want to tell them that. You just want to tell them, what you saw, that it was cold in the operating room, that they cover you up with all these blue drapes, but you're asleep, etc., etc. Disease prevention and health promotion for individuals, families, and communities. And then any type of clinical processes. That means, for instance, and this is just a kind of a simple one, but um, if a patient is admitted, let's say, like what is the process for even getting a nurse to come into your room? Well, you have this call light and you press this button. Um, we come in and take your vital signs so often. Lab usually draws blood at this time. Breakfast is at this time. Lunch is at this time. Dinner is at this time. So all those clinical processes. So this is one of those clicker checks. The nurses must possess the knowledge and skills needed for patient teaching so that A, they can complete the documentation forms related to client teaching accurately, B, they can help the hospital meet Joint Commission standards requiring client teaching, C, they can promote the health, safety, and rights of clients through education, D, they can meet the patient's rights delineated in the patient care partnership. So think about that for a minute. So the correct answer here is C. I'm going to go back so you can see what C is. They can promote the health, safety, and rights of clients through education. Okay, so on the flip side of teaching is learning. Learning is a change in behavior, knowledge, skills, or attitude. Learning occurs as a result of planned or spontaneously occurring situations, events, or exposures. So think about the situation that we're in right now. Did you ever know that there was such a thing as coronavirus? Coronavirus has been around since the 1960s, but now all of a sudden, because of this strain that we have in 2019 or found in 2019, a lot of people are learning because of this pandemic. So again, learning occurs as a result of spontaneously occurring situations. We didn't plan this situation. We didn't plan this event or exposure, but we are learning about it because here it is with us now. Learning is goal oriented. Again, remember those SMART goals. It's intended, it's deliberate. And one thing that it involves is a motivation to learn. You have to be motivated to learn and give it your best conscious effort, or you're not going to learn. Without active participation in the learning process, we can also learn. Like we learn subconsciously when we don't even know that we are learning sometimes. Like when you watch the news, you don't know that the information that they are giving you that you are learning. Hopefully it's not false information. Learning is an active process involving more than giving of information. So in other words, just because you have a teacher doesn't mean, like just spilling out all of this information and all these words. Just because you have the teacher doesn't mean you're going to learn anything. You have to actively participate and actively read. You have to do all these things. And with a patient, it's the same way. If they are not motivated or not ready to learn, they're not going to learn a thing because they will just shut you down. They'll shut you down, or they will completely turn off the volume. They'll see your lips moving, but they're not going to hear anything you're saying. So, again, it is an active process. I wanted to show you this. This is, and you may have seen it before in a bit of a different format, but this is what we call Bloom's taxonomy. And actually, we write your test questions utilizing this model. So the lower level learning is remembering. So it's just basic knowledge, recognizing that something is a fact. So that's a very low level of learning. So you'll notice that most of the questions that we like to ask you are more of an application nature at this point, or understanding. We want you to understand concepts. We want you to be able to apply things. But the farther you get in a nursing program, you're going to be analyzing things more and evaluating things more. So that's the only reason I really wanted to show you this. And they do mention this in your book. If I can find it. I know it's in here. They talk about Bloom's taxonomy. So on page 399 in your book, They have the domains and levels of behavior on table 19-1. It's Bloom's domains of learning. So in just a second here, we're going to be talking about the cognitive domain, the psychomotor domain, and the affective domain. So you can look at that on page 399. So the three domains of learning include, number one, the cognitive domain. Cognitive domain requires storing and recalling information in the brain. So cognitive is thinking. That's what that means. It's thinking. So we recall, we comprehend, we have the ability to analyze and apply and evaluate ideas. So that's a cognitive domain. So if I go back to Bloom's taxonomy, cognitive means thinking. So it includes many of these levels, or actually all of these levels. But at what level do we want you to learn as a nursing student, or what level do you as a nurse in the future, what level do you want your patients to learn at? Usually when you're teaching a patient, you want them to be able to understand. You want them to understand how they give an insulin injection to themselves, that type of thing. So again, the cognitive domain of learning includes 6 levels of behavior: memorization, recall, comprehending and analysis, synthesis, that means producing something, application, and evaluation of ideas. Strategies and tools that support teaching in the cognitive domain include lecturing, reading materials, discussions, audiovisual materials, and programmed instruction, computer-assisted instruction, and problem-based learning like case studies and care plans. So go figure. We want you to think. So look at all, or think about all of those ways that we deliver content through lecture. We want you to read. I like very much to discuss things in class. So this to me is just kind of talking to you. So I like when I get responses from students. But I do like to include audiovisual material like videos. That's why I want you to look in your modules to make sure that you are looking at all the videos that are provided, and any kind of computer assisted or virtual instruction, and do your case studies and do your care plans. Psychomotor. The psychomotor domain of learning is the hands-on or kinesthetic. So psychomotor skills include sensory awareness involved in learning, and performing skills, and creating new skills. So it requires the learner to accept and value the skill. Accept and value the skill, as well as know about the skill. And again, that's the cognitive domain. Strategies and tools used to teach psychomotor skills include demonstration and return demonstration, simulations, audiovisuals like videos again, journaling and self-reflection, and printed materials. Like if you are teaching a patient who is a hands-on learner, perhaps you could provide them with a pamphlet, especially if it's got pictures and drawings, so that they understand what they're supposed to do. The affective domain of learning. Affective means that is feelings, like how do they feel, or how do they believe, or what's their attitude and value about learning this. So strategies and tools for promoting affective learning include role modeling, discussions, role playing, mentoring, one-to-one counseling and discussion videos, and again, printed materials. So the affective domain of learning. How do people feel about what they are learning? So again, I want to point out page 399 and the table 19-1. Do you have to know all of that for a exam? Absolutely not. But again, just understand that Bloom's taxonomy and what cognitive learning is. Cognitive learning is thinking at all of those different levels. Psychomotor learning is skills and hands-on learning. And then affective learning is how somebody feels and what their attitudes and beliefs are as far as the learning process. Factors that affect client learning. And this starts on page 400. First of all, motivation. Motivation is the desire from within. You cannot give someone motivation. Like they have to be motivated from within to learn. So motivation is created by an idea or a physical need, an emotion, or some kind of force that like they want to learn. They want to get this information. Motivation is greatest when patients recognize they have a need to learn. They also are greatly motivated when they believe it is possible to improve their health and they're interested in the information they're being given. So if you tell a patient, what I'm telling you about your blood pressure is going to help to improve your health, if they believe that, they are most likely to listen to you and be motivated to learn what you're going to tell them about keeping their blood pressure under control, like limiting their salt or whatever you're going to be teaching them. If you tell them that it's going to keep their blood pressure down and affect their overall health, they may become more motivated to learn from you and internalize it. So readiness to learn. Readiness to learn is a demonstration of behavior that indicates that the learner is motivated and able to learn at a specific time. So if somebody says, yeah, I'm ready right now. I really want to do this. I really want to get a handle on this. So they are exhibiting their readiness to learn. So you have to look at their physical condition. Physical factors like pain and their energy, their mobility, their senses, all contribute to a patient's readiness to learn. Somebody who's in pain is not going to pay one bit of attention to you because all they're focused on is their pain. Just like we hear today in elementary schools, children are having a difficult time learning because they're hungry. That's what they're concentrating on, is their stomach being empty. So that is why free and reduced lunches are being provided or breakfasts are being provided, because the physical condition determines partially their readiness to learn. Emotions also come into play as far as a patient being ready to learn. If they're severely anxious, they're stressed, emotional pain also interferes with the ability to learn. So in addition, the learning itself and the idea that behaviors have to be changed can create anxiety. However, a mild level of anxiety can enhance learning by providing motivation. So it can be a little bit confusing. But if somebody is overwhelmed by their situation, again, they're not going to listen to you. But a little bit of stress and a little bit of anxiety can help somebody learn by providing motivation. For instance, if I didn't have a little bit of anxiety about getting my work done, I wouldn't do it. I'm not motivated to do it. So there is a difference there. So when somebody tells you again, now is a good time for me, they're probably ready to learn. Okay, timing. People retain information better when they have an opportunity to use it soon after it is presented. So think about that, soon after it is presented. So for some concepts, the learners might need more time to be able to absorb and apply information, however, especially when more complex thinking is required. So you have to take that into consideration as far as timing. Do you need to start right away when they come in and start teaching, or do you wait? Active involvement. Learning is more meaningful when the patient is actively engaged in the planning and learning activities. Learners retain 10% of what they read, but they retain 90% of what they speak and do. Feedback. Positive feedback encourages learners and boosts morale when it comes to tackling difficult content or devoting the time and effort needed to get the most out of the educational process. So when you're teaching a patient, I'm just going to keep going back to that diabetic who's learning how to give himself or herself an insulin injection. Excuse me. If you tell somebody, oh, that wasn't the way I taught you, or maybe it would be better if we taught your family to help you, that kind of thing. If you don't learn this, you can't go home. All those that is not good feedback. Good feedback is constructive. And so if somebody's having a difficult time with doing, let's say, that insulin injection, well, give them feedback as to how they can improve. Like the next time, instead of trying to push that needle through your skin, throw it like a dart, and get it in so it's not painful, that type of thing. You don't ever tell somebody that, a kid can do this, like a kid can do this better than you, or whatever. That's just not appropriate. So give people constructive feedback. Another factor is repetition. A patient is more likely to retain information and incorporate it into his or her life if the content is repeated. So repetition. Each time the learner hears the information, retention increases. So the more you teach the same thing to a patient, the more likely they are to learn it. You also want to look at the learning environment. An ideal learning environment is private, quiet, physically and psychologically comfortable, and free from distractions. Scheduling the session. The teaching time doesn't always need to be long, just needs to be uninterrupted. So based on the client's condition, like are they fatigued, are they in pain, what's their attention span, shorter teaching sessions can be best for comprehension and retention. So you just have to keep that in mind as well. What is the amount and complexity of the content? The more complex or detailed the content, the more difficult it is for most people to learn and retain. The greater the change, the greater is the challenge for both teacher and patient. The greater the change, the greater the challenge for both teacher and patient. Teacher and learner communication. Again, barriers to communication include pain, anxiety, fatigue, illness, hunger, dysfunctional relationships, language differences, vision and hearing impairment, cultural factors, and various environmental issues such as noise and distraction. So again, your patient is not going to learn if they're in pain or if they're anxious or they're fatigued. If they feel, gave you the example of children being hungry in school, they're not going to learn. So just keep that in mind. If a patient is fatigued, let them take a nap. And then after that, schedule your teaching, and then they will be able to um, have a teaching session. So again, the amount of complexity of the content, more complex or detailed content, the more difficult it is for people to learn and retain. So the greater the change, the greater the challenge for the teacher and the client. So in your book, they give you an example of like new parents, for instance, who need to learn isolation precautions for their newborn who's been diagnosed with an immune problem. They're going to be much more difficult to teach and harder to retain information than some new parents who you're just teaching how to diaper their baby or give them a bath. Or the other example is somebody who is in rehabilitation after a stroke who has to relearn how to use their eating utensils or swallow or any other basic task that they would learn through occupational therapy. That is much more intensive education and training than just teaching someone about their medication to begin with. So just things to keep in mind. Teacher and learner communications. So barriers to communication again include pain, anxiety, fatigue, illness, hunger. We've talked about this already. Noise and distraction. The next thing I want you to learn or know is belonging to a special population. So what is the special need for the person? If you are not familiar with what the patient's condition is or what the patient's disease is, then you have to get some education about it. So you have to know about it before you can ever teach somebody about it. Make sure you include a family member, a caregiver, or other significant other in the teaching to reinforce the learning and act as a safety net for helping that person retain the information and implementing any new knowledge they get. Again, the developmental stage. They go through this on page 403 of your book, and I mentioned this a while ago about children. So you have to know intellectual development. That will help you to gear your teaching strategies and content to the level of the learner. So they talk about the different stages of cognitive development in children, according to Jean Piaget. So they go through 2 to 7-year-olds, and 7 to 11-year-olds, and then 11 and older. So all of these different developmental levels learn differently, or you provide different learning tools for them. Like, I'll just give you an example. In the pre-operational stage, for instance, kids who are 2 to 7 years old, if they're going to surgery, or no, I'll give a different example. If they're going to get a injection, you would take a doll. Let's say you take a doll and show with a syringe on that doll, like what would happen. to the doll so that they would know. So they go through they have a whole paragraph on teaching children. So you have to learn some strategies to gain trust, and you have to help calm their fears and help them cooperate, because sometimes they have a hard time cooperating because A, they have stranger danger, and B, they think things are going to hurt them. So just more things to bear in mind. And then they also have a section on teaching older adults. There's numerous factors that can be barriers to their learning, like, can they even hear? Can they see? Do they have dementia? If it's noisy and chaotic in the background, they have a hard time learning. So just make sure, if they can't see or using large print, if you're trying to talk to them about something, that you're not yelling at them, but that you're using a tone of voice that they can understand and speaking at a level that they can understand. So just keep that in mind, again, on page 403. Excuse me. Cultural sensitivity. That involves respect for the patient's identity and needs, regardless of who they are, where they're from, how they speak, how old they are, what religion they practice or not, whether they're disabled or not, how much wealth or poverty they experience, how much they weigh, how socially popular they are, or any other aspect that can lead to unfair treatment. So what is their culture? And try to embed that in your teaching modalities, and try very hard. If you have any type of prejudices, try not to convey them. I mean, you have to not convey them, actually. And hopefully you don't have any prejudices, but health literacy. So what does health literacy mean? It's the ability to understand basic health information and services so that people can make informed decisions. So, on the contrary, health illiteracy occurs when the language spoken is not the patient's preferred language. Like maybe in this country, maybe it's people who have a limited English proficiency. We have a high number of people in the United States who can't read or write English. Reading literacy is yet another significant barrier interfering with the communication between patients and healthcare providers. So something to take into consideration. So what if you did have someone who did not speak English? If someone does not speak English, probably the best course of action to take, unless you can speak and understand the language your patient speaks and understands, you need to probably get an interpreter. Promoting health literacy with patients. So when you deliver information to people, you want to make sure, obviously, that they're going to be able to understand it. So you ask questions, not yes or no questions, but how and what questions. You help your patients fill out their forms and their health histories if you need to. You organize information so that the most important material stands out and it's repeated for emphasis and clarity. So maybe, putting something in bold somewhere. Present information in 3 to 5 chunks at a time. So don't give them this entire big, huge page of single spaced words because they're not going to be able to understand it. Write out instructions and appointments using plain language. Avoid medical jargon and technical terms. That is very important, and I guarantee you're going to have at least one of those questions on the test. And it won't be like a knowledge question. It'll be an example, and you'll have to say like what's wrong with this example or whatever. So for those with low health literacy, printed materials should have words with 3 or fewer syllables and sentences with fewer than 15 words. Speak using simple words, short sentences, and structuring sentences with active rather than passive voice. For example, instead of saying, the pill should be taken every 8 hours, say, take the pill every 8 hours. So that is health literacy and how to maybe overcome the health illiteracy a little bit. On page 406, since we talked about cultural competence in teaching, on page 406 in box 19-3, they have culturally competent teaching, like providing feedback, how to do assessments, how to do interventions, that type of thing. So please look at that. So here's another knowledge check. The client needs to be taught how to find and check his own radial pulse. The nurse will complete this teaching, A, only if the client asks her to do so to avoid causing stress, B, when the client recognizes the need to learn the skill, C, before pain medication is administered when the client is alert, D, right before the client is discharged so he can remember the skill. So think about that one for just a couple minutes, or just a minute. The answer is B. The client will be most motivated to learn when he recognizes why the skill is important to the success of his overall treatment plan. So again, the person has to know that they need to learn the skill. Okay. Components of a learning assessment. So what is listed on this slide are things that need to be assessed prior to beginning the teaching with a patient. By doing these assessments, you'll be able to identify factors that will enable you to tailor your teaching to what your patient needs and what your patient is capable of. So again, starting on page 407, it goes through all of these. The assessment. A learning assessment will help you to determine the right setting for the teaching, the necessary content to cover, learning goals, and teaching strategies. So it's pointing out learning needs and the knowledge level of the patient. So they give you examples also in here. Health beliefs and practices. So what's the person's current healthcare practice? And do they trust the healthcare system at all? What's the physical and emotional readiness of this patient to learn? What's the patient's ability to learn? Ask questions. What's their educational level? How able are they to learn? Again, talked about literacy level. If a person is illiterate, and they cannot read then it's not doing any good to provide them a pamphlet. And then what is that health literacy? Health literacy. What do they know about healthcare and their disease process and their medications and how to navigate through the healthcare system? What is their ability to see and feel and hear and hang on to things? What is their learning style? And what does that even mean? What is your learning style? Are you a visual learner, which means that what you see, you can learn? Or are you an auditory learner? What you hear is what you learn. Are you a kinesthetic learner, a hands-on learner, where you have to do psychomotor skills and actually manipulate objects to be able to learn? Or do you have a combination of those things? So what is the person's learning style? And what kind of time constraints do you have? Like, when is this patient going to go home? Or are they in a clinic and they're going to be leaving the clinic? And what are the patients or the resources, healthcare resources available to the patient? So all of those are questions you can ask and take into consideration when you are doing a learning assessment on your patient. The client is given a pamphlet to read about how to manage his newly inserted central venous access device. It will be most important for the nurse to assess the client's A, health beliefs, B, literacy level, C, fine motor abilities, D, ability to see. So let's look at this question. The client is given a pamphlet to read about how to manage his newly inserted central venous access device. So of those four, what do you have to know about that client if you're assessing them and the person is getting a pamphlet to read? So if the client has vision problems, the nurse will have to find another strategy to convey that information. If they can't see it, they can't use it. Now, on the other hand, one of the other choices was B, literacy level, and that would also be something that you would have to consider. What is in a teaching plan? Teaching strategies, the method used to present the content being taught. What is the content? This includes information your learner has to understand to reach the desired goal. It can include facts, skills, or emotions. So how do you organize your teaching plan? As a general rule, you should present simple before complicated topics, and non-threatening topics before more controversial ones. You have to determine when the teaching sessions should be scheduled based on the patient and the teacher's needs. When extensive content is involved, it is best to schedule a teaching session in advance. Schedule a teaching session in advance when the content is extensive. The teacher and learner are then committed and prepared for the session. Using small amounts of time can be effective if teaching is brief and organized. So if you have somebody who is going home who has just had a new life-altering surgery, you would want to schedule teaching, and you might want to do it in small increments. What are the instructional materials that you're going to be using? Tools that are used to introduce information and reinforce learning. So again, if you're going to be teaching somebody how to use an insulin pen or how to give an insulin injection, you're going to want to actually have those tools as part of the instructional material. Teaching strategies. Group discussions. Several participants discuss topics, engaging and exchanging information and presenting their points of view. The teacher is a facilitator. Openness to new ideas and confidentiality of the content expressed are essential for participation. One type of group discussion is brainstorming. And brainstorming is used to generate new ideas for solving a problem. Can you do brainstorming with your patient? Yes, and absolutely. Like if they don't have particular resources at home, well, how can we get these resources? You can brainstorm with your patient. Demonstration and return demonstration. Teacher explains and demonstrates a skill. The learner then demonstrates comprehension by returning the demonstration. And again, this is good with the teaching a person how to give themselves an injection. So this is one of the highest retention. This demonstration, return demonstration, has a high rate of retention in the educational process. So that is probably something that you need to know. So other things, audiovisual materials can include videos, computer animation, audio clips, films, slides. They can be effective supplements to other methods of teaching and followed by question and answer. Printed materials can be in the form of fact sheets, discharge instructions, pamphlets, or detailed booklets. But you have to make sure that your patient's literacy level is assessed beforehand. Like any printed material, can they understand? A lot of printed material these days is at a 5th and 6th grade level, so that most of the population can understand what is being taught. Online sources of information. There's just extensive information geared toward the lay public, as well as healthcare professionals on the internet. But you have to make sure that if you are using some kind of online website to get patient information, like for patient teaching, you have got to make sure that it is a credible website. You can't go in and use Wikipedia. That's just not appropriate. So there is a listserv. It's called the Joanna Briggs Institute, and that gives nursing a lot of information on best practice. So again, it's called the Joanna Briggs Institute. Evaluating learning. You know how we evaluate learning for you. You have a lot of exams. Tests and written exercises can be used to measure how well someone has retained the information. And it really requires that the learner be actively involved and has adequate literacy skills. Oral questions, interviews, questionnaires, checklists allow patients to evaluate their own progress and determine future learning needs. You can always get more information by talking to your client. However, you may get more honest responses by using written questions and providing for anonymous completion of evaluations. Again, if you are ever giving feedback from these evaluations, make sure that your feedback is simple to understand, and that it is in a constructive format. Direct observation of performance are anecdotal, descriptive notes that you make of the learner's performance. So you're taking notes and documenting the patient's performance level. So when you look at them in the future, they'll help you to provide feedback to the patient, either to reinforce that their learning is accurate or to correct any misinformation. Provide feedback as soon as possible after you observe performance. So when you're sitting there teaching that patient how to give a self-injection, give them feedback right away. Documentation provides legal evidence that teaching was done, and it communicates the information to other healthcare professionals that the teaching was done. Write objective statements about what was taught and the client's skills and behaviors that demonstrate learning. For informal teaching that occurs during other care activities, you can simply record in the nurse's notes. But for planned teaching that is provided frequently for a particular population, many facilities provide special documentation forms. So even checklists. So again, it's going to be determined by what facility you work for as to what documentation you need to do on your teaching plan. So I want you to turn to page 408, where they talk about nursing diagnoses. And this is actually kind of an important thing here because they're talking about deficient knowledge. You know, most patients, yes, do have deficient knowledge. So that because there's a lot of things that we have to teach them, but you have to determine, you know, is their main problem that they're deficient in knowledge or not? So your book is saying you should use deficient knowledge only if you believe that the lack of knowledge is the primary problem. Use it to describe conditions in which the patient needs new, additional, or extensive knowledge. So this is saying, for example, deficient knowledge for somebody who needs diabetic foot care, deficient knowledge related to lack of prior experience as manifested by anxiety and many questions about foot care. So that person's primary problem is that they lack knowledge about their foot care, and they're really anxious about it and asking a lot of questions about it. That's their primary problem. On the other hand, it can be the etiology, and this would probably be a lot of cases. Deficient knowledge is probably most useful as the etiology of other nursing diagnoses, and they give several examples here. Ineffective health maintenance related to deficient knowledge of immunizations. Risk for impaired parenting related to deficient knowledge of child development stages and need for stimulation. Ineffective self-health management related to deficient knowledge of the procedure for drawing up and injecting insulin. Risk for imbalanced nutrition less than body requirements related to the pregnant woman's deficient knowledge about additional calories and nutrients needed during pregnancy and her fear of getting fat. So those are, can you see the difference where deficient knowledge can be a primary problem or it can be a secondary problem and be the etiology of one of the primary problems. Do not use deficient knowledge for problems involving the client's ability to learn. So you would write those as impaired ability to learn related to, impaired ability to learn related to, lack of motivation to learn related to. Those aren't necessarily deficient knowledge. So always look beyond the knowledge deficit to see what the problem is. So do not use deficient knowledge routinely as a problem label for all patients. Make sure you look at that on page 408. Page 411, you have this really nice teaching plan. So I want you to look through that so you can see what a teaching plan looks like. And like they have in here, like what they want the teaching environment to be like. And what's the strategy or approach to teaching? What are the instructional materials used? What are the learning objectives? That type of thing. And then what is the evaluation of the patient? Okay, so I'm going to flip through your test really quickly and make sure that I have gotten everything in here that you need to know. I put check marks as I go through, so I know that I have taught you everything that is going to be on this test. Again, make sure you know the 5 rights of learning. Know about motivation for sure, and how something can be worded well for patient understanding when you're providing them with instructions. What's the difference between motivation to learn and readiness to learn? How do you provide feedback? What are the different learning styles? What is cognitive? What is psychomotor? What is affective? What does that mean? What is teaching? What is learning? When is it best to teach your patient? What is a goal? What if your patient can't speak the language that you speak and you don't speak that language? Know about literacy of your patient. What are barriers to learning? What do we have to do so people can retain the information that we provide? What are the most effective strategies for teaching psychomotor skills? And why do nurses teach at all? Why do we teach in the hospital? What's the purpose of that? So just some things to keep in mind. You can listen to this over and over. So I will provide you with, the percentages of the different topics on your test so that you know. But this that we have just gone over is teaching and learning. So thank you, and I will get back to you with the next lesson. Thank you.